Good afternoon. This is Bernard Green, Chair of the Select Board. This is a emergency meeting of the Select Board. The crisis, the COVID-19 crisis, is an ongoing crisis and does not respect our weekly schedule. So I think it's important to give the board an opportunity to get an update occasionally with respect to where we are on the so-called trajectory of the virus, as well as information from our health director today on the latest information with respect to health department's recommendations for mitigation. So I guess we call on Dr. Jett to give us some information, and the select board should, I guess, feel free to ask questions, but let's not deliberate. Even though this is a posted meeting, it's not a regular board meeting, so it's an informational session. Dr. Jett.
All right, good afternoon. I just want to provide everybody a brief update of the numbers we have seen today, and then give you a trajectory of how we compare to other communities. So, started back on March 13th, we had 2 cases. Every week since then, we have doubled in the cases, but not to the extent where it was exponentially. So as of yesterday, we had 98 positive cases. We had an additional 15 presumptive, or a total of 113 cases of COVID. Now, 1 month removed out, we were supposed to be, if we were doing exponential growth, 1,024. So we are well below the curve. So we're doing more of linear. Actually, from 327 to 4/3, we had 27 cases on that date. On April the 3rd, we jumped to 66 cases. Since then, we have since been back linear. So if we want to compare to other communities, and I felt remiss, we do have 1 death now, as reported to me today. Don't have any further details. We'll be reaching out to the family. So at this time, we try to keep it as private as possible. Newton, well, start with Cambridge. Cambridge has 209 and 1 death today. Newton has 264 and 12 deaths as of today. And Boston has 2,812 with 34 deaths today. So as far as operations overall, we have 12 epidemiologists on staff doing contact tracing. That includes environmental health, school health staff. I've also recently added 2 advisory council members to the contact tracing, and myself and Nurse Barbara Wesley. And so that's just a brief update in terms of coronavirus in the community. And I can open it up to any questions.
I have a question.
Yes, ma'am.
We have 95 cases and we're well below the curve, but how much testing have we done compared to the other communities?
So here's the thing. We haven't done any exact testing. That's where you have some of the presumptive cases. So we haven't tested asymptomatic people. But anybody that has been severe symptomatic have been tested.
Mm-hmm.
The hospitals have turned people away that just had mild symptoms. But next weekend will be our first test. We got an agreement with Physician One Group, and I'm working out the final details. So next Saturday, we will have our first testing site on the ground. We've also had opportunity to test in a nursing home when we started to have positive cases last weekend.
So we don't really, I mean, it looks like we have good numbers, but we don't really know how good they are or if they're even good because we haven't done the type of testing that would identify cases that are below the level of significant symptoms. Is that?
But the only one I could say that I've known has done significant testing is in Boston. I don't know if Newton or Cambridge has done significant testing. And even so, their populations are different.
Right.
So
I have two questions. One, it should be just kind of straightforward. I forget how many people live and reside in Newton. So just so that I have some sort of comparison as to, you know, their numbers versus our numbers versus the whole. And then the other question is, are people trying to figure out how these infections occurred, or is it just so difficult to account for everyone that you came in contact with over the past 2 or 3 weeks that it's almost impossible?
no, the only way we knew in the beginning because it started with Biogen, but after that, we don't know where people have been exposed to. Sometimes it comes right through.
I think we lost him. Looks like his computer is rebooting or something.
Okay. Can everybody hear me?
Yep.
Yeah.
Oh, yeah.
Okay. So what I was saying was, yeah, I forgot. What was your question again? I forgot my train of thought.
So no worries. 2 questions. One, you were starting to tackle, which is trying to trace back like how people got infected. And then my other one, actually, anyone, if they know the answer to this, how many people live in Newton?
I think it's 100,000.
87,000.
87?
No, so it's fairly close to Brookline.
Well, we're 59.
How about
Certainly
Cambridge?
closer
Does
than
anyone know?
Cambridge.
Yeah.
Cam-
How large is Cambridge?
Over
Cam-
100. But
And Boston is about 600, is that correct? Or more?
Almost
I'll
700.
find out. I'll find out. Why don't you start talking and I'll confirm the numbers and I'll just send it over the chat feature.
Okay.
Thank you.
So the other one, your other issue, Heather, was about the contact tracing and
Yeah, so
wanting-
the contact tracing is just when we do the investigation, if a person knows they were exposed, we will have that information. But sometimes people just don't know where they were exposed. A few times we have known, like it was at a grocery store or it was in a nursing home. But outside of those things, if it's not like in a confined cohort, it's very hard to detect.
Thank you.
I've got a question about personal protective equipment. There's been widely reported that hospitals and other local physicians and medical workers are running short on personal protective equipment. I'm wondering how we're doing in Brookline, particularly focused on our frontline public safety officials. Do the police and the fire have everything they need to be safe and continue to do their job during this COVID-19 crisis?
So what I know right now, everybody has enough PPE. We have been consistently ordering PPE. One of the things I would like to do is have some extra PPE on hand because I'm finding that it's a shortage in nursing homes and the ability to be able to do swabs. So I've made several requests to the state and also the National Guard to do some extra testing and extra swabs in these facilities. Because to me, it's very important to have not only the information about the people that are symptomatic, but also asymptomatic, so that we can properly move them around in the facility away from people that do have COVID.
So do we have good sources for this equipment, or are we bidding against the federal government and everyone else? Or
Well, we've been bidding against everybody else. But one of the good things is, I mean, I've seen some backed up orders, but one of the things I do know that happens is when first responders need it, we get it quick. Also, the state just put out for all nursing homes now, they have extra testing that can be done. And so that opens up another gateway for us. And that's not just for symptomatic, but also asymptomatic. So before they only tested symptomatic people in nursing homes, now they're moving forward to testing everybody. So that's better. I
I mean,
think Big wants me to move for better lighting.
Do you agree with Dr. Fauci that even when the numbers look fairly good, we can't slow down? We have to keep focused on our mitigation efforts?
Well, computer problems, I think.
Yeah, I'm getting that too. One of the problems is that everyone is on the internet for various reasons, and it's overloading the bandwidth, as I understand.
It looks like Dr. Jett is back with us.
Yep. Okay.
Did you hear that
Yes.
last question?
I didn't hear it in totality.
Okay. My question was, would you agree with Dr. Fauci, the infectious disease guy, that despite good numbers, we really can't let up our mitigation efforts?
No, we can't at this time. And the reason being, in my perspective,
We can or cannot?
we cannot.
Okay.
The reason being, we have not peaked as a nation overall, and we probably haven't peaked as a community. And so if we let up on the mitigation efforts, you could stand a chance on another spike and an outbreak. So, to effectively do it, we probably need to continue to do this well into May in order to make sure we reach that peak. And then we can see the downturn. And that would be, we should look for a peak in the number of cases and a peak in the number of deaths. And before China even moved to, say it again.
And the deaths lag behind the cases, right?
Correct. So what I can do, because for the task force, I provide the slides that actually show from the European CDC, the peak of projectable for everybody is moving in terms of confirmed cases and confirmed deaths. And then we will be able to take a deeper dive into what's happening overall in the state and the nation as well, compared to other places. But we're nowhere near that right now.
Dr. Jett, without getting into
these projections are based on models that those people, right? These projections are based on models. Are they available for people to, I don't know, dig into, like we like to do here in Brookline?
So I can provide the slides from what I've seen through the European CDC. I haven't seen the modeling that was done by Northeastern and provided to the CDC.
Okay.
So I do not have that, what's going on, but I can provide what I've seen.
All right. Raul, you had a question?
Down there, in terms of European CDC, they have provided that.
Yes. I wanted to ask Dr. Jett, without getting into specific measures, at this very moment, with Brookline's approach to mitigating the spread, right now, do we need to put our foot on the gas and get a little bit more aggressive? At this moment right now, considering the next few weeks to come, where would you say we are and where do you think we need to be?
So I think that the best we can do right now is continue on a path that we are. We need to ensure that everybody is wearing a mask. I really don't know how to enforce that, but encourage that. We need to not provide avenues for people to be out more in the public. We need to continue to work with local business to ensure that, one, they move to more of delivery instead of takeout. And I think the angle that we should be looking at is how do we reduce face-to-face contact? How do we reduce people being outside the home. The most effective, and from a technical standpoint, the reason we say in the public health field is to stay home is because we know if somebody's positive or they have symptoms, it spreads within a household, but it will not spread from household to household if everybody's in. And so that's how China effectively was to reach the peak real fast, because they ordered everybody off the street. Everybody that was sick, they was infected. It was 14 days. The next group that got infected, 14 days, 30 days elapsed. Everybody was sick. They reached the peak. So that's why you see the messaging around stay at home. There's a methodology to it. It just wasn't explained because of the incubation period. But the incubation period has a lot to do with it. In the beginning, I talked about norovirus. It usually takes 3 or 4 days, it spreads. Well, you double that, and that's how long you need to shut down a facility to ensure you stop the spread. Same thing you do with any disease.
Thanks.
You're welcome.
You're muted, Nancy.
Unmuted myself. So apparently this morning the governor tweeted that everyone should stay home. So I guess that's the message that he's conveying. And I can read you the tweet if you want. Staying home is the best way that we can slow the spread of COVID-19 and save lives. Residents should stay home and avoid going outside, except for essential activities like going to the grocery store or pharmacy. So I think, that's the message that he's sending. And I think it would be good for us to send the same message, given what Swanee is telling us. We haven't reached the peak, and we don't know exactly when that's going to happen, but it certainly will happen later if we have people outside walking around, who may, the problem is they may not feel sick, but they're asymptomatic. And so they don't know they have anything, and they don't mean to give it to anybody else, but that's what's happening.
What about Dr. Jett, along those lines? It's interesting. I also, just before we got on, was listening to the governor's press conference, and he just said something about it being okay with people walking around and also going for a run. So I don't know that his direction has been that clear, frankly. But Dr. Jett, what about this issue with people out running on sidewalks and places like that? Is that something we should be discouraging? Does that, I don't know the science around this, does that provide more opportunity for transmission? What should be our messaging around that?
So the if we ask people to stay at home, the message should be consistent. And how do you essential item? Going out for a run, that's not essential. Going for medicine, groceries, that is essential. And then, protecting yourself while you're out. The goal is to stop transmission. And if you constantly are out in the public, you stand a chance of either you transmit to somebody, since we're not doing testing for asymptomatic, or you stand the opportunity to be exposed to somebody. And so, the message should be, you feel good today, but tomorrow you might not. Well, why the day that you felt good might be the day you actually transmit it to somebody else. And we don't know that. That's why right now we're asking everybody, if we find out that you have been exposed, you have COVID, we actually quarantine people 2 days prior to that. And we find that all of your contacts 2 days prior to that. And that's before you show symptoms. So that is the latest science. And I think in order to protect the overall community, we have to have a consistent message in order to keep our numbers down. I think we have done some great things in terms of advising the restaurants, stopping some of the things that were non-essential. But I think the final push should be ensuring that people stay home. So the faster we move everybody to stay at home, the faster we can return to whatever the new normal would be. Because there's a lot of people out of work. Domestic violence is increasing. People are having more mental health issues. There's more drug usage because we're staying home. So the message I think we need to continue to convey is the faster that we move to stay at home, doing that, the faster we can return to whatever the new normal life will be.
Is one of the issues I think we've been sort of weighing is sort of the need to keep everyone safe and to mitigate the spread of this virus with I'll just use an extreme version of this, not wanting to turn Brookline into a police state where we are telling people that not only should they stay home, but they literally cannot leave their homes. And I think let's say, and I don't know where our board is, and this is not the appropriate time for us to have a discussion about it, but I want to get your feedback about, let's say this board decided to adopt more stringent measures, whatever that is, right? Not getting into the details. How long do you think, because that would be a concern of how long those stringent measures should actually last, because we don't, the idea of saying that we're going to, let's say there was a stay home order or something like that, and everything that was involved with that in Brookline specifically, understanding that a regional or state strategy would be significantly better than just a Brookline strategy. But let's say there was, it'd be really tough to say we're going to do this indefinitely. We're going to sort of limit people's freedoms indefinitely, those kinds of things. Based on the best available science and data, how long would something like that need to last to have the desired effect? If it's even advisable, and you can tell me it's not if you think it's not.
Well, again, I would double the incubation period, so it would be 30 days. So that would be my recommendation. And that's sort of what you see happening incrementally with the nation, and you see it in the governor order. So they are receiving the same public health advice to move incrementally in that direction.
You mean 30 days from today, or for whenever we announce it, or
whenever you announce it, it'd be 30 days.
Oh, okay.
Okay, that's sobering, but on the other hand, if we don't do that and it continues to spread, we could be in this situation much longer. Is that not correct?
That is correct. That's why initially, because it's done in phases, just like when right now, the White House released coronavirus response, a roadmap to reopening. In that reopening, is done in phases, and is largely dependent on what states have done in terms of reaching the peak and reduce the number of cases. So I did a little discussion with the task force about it. But those are what they have in there is we need to do better surveillance. We need to do better testing. We need to reach the peak. We need to release some of the restrictions we have, but do it in phases. Because if you're not careful enough, September, when school is back in, an outbreak would restart again.
Mm.
So my understanding about flattening the curve was to basically give us time and resources to treat those who get infected, right? So trying to stop the virus or prevent this pandemic is just not really all that feasible because people continue to get sick. But we wanted to bend the curve so that it didn't go in that exponential equation and overwhelm the hospitals and take up all the respirators and whatnot. It looks like, and I understand that we're not doing testing widely, it looks like for the amount of population that we have flattened our curve in town. So I guess I'm wondering, do we double down on measures like closing our parks and ordering people to stay at home when I think that we have been fairly successful at putting the measures that we have in place So what is your opinion about those things?
So one, flatten the curve is two things. You did state correctly that it is based on putting measures in place until we can do a vaccine. Now, keep in mind, they have predicted vaccine could take 12 to 18 months. I don't think it'll take that long. But the measures that you put in place to ensure that everybody can still have some form of life, but not a lot of disruptions, is by the mitigation strategy. That's the most effective way to, number one, prevent surge capacity at the hospital. So that's why you move to, if you go back, and I don't know if I shared it with the board, but there's a mitigation plan 2017 that CDC wrote. It's the same plan that New Rochelle used, Seattle used, and I pulled from that plan for Brookline. The state also has a very similar plan. The measures started close the school, close non-essential business, do stay-at-home orders, close the beaches, etc. So we have implemented a lot of those factors. If you start to see, and in the mitigation plan is built in, if you get to a certain trigger, a certain number, then you need to step up your efforts more. Luckily in Brookline, we never had a curve in order to flatten it. But one of the reasons we never had a curve is I noticed quickly that cases started coming in, and I added staff and shut down our normal operation of environmental inspections, and I turned everybody to contact tracing. So we have more staff doing contact tracing, believe it or not, than Newton. When I called the state to talk to them recently, they said we have more than most people around the state. The state is helping everybody else. They have 40 epidemiologists covering 351 towns and municipalities. So they are stretched very thin. I have a total of almost 15 inside of Brookline alone. And that means every time we get a case or we have to quarantine somebody, we make the call not within 24 hours, usually within 5 hours. And then we do the contact tracing and make sure that we implement that immediately. If it's a nursing home, I know that the state is, they sort of the lead, but I waste no time to contact them right away and try to put in mitigation. Other places are not as fortunate to have that. So you have to measure when do you want to step up measures, or is what we're doing good enough for right now, and keep our eye on what's going on. But I wouldn't relax what we're doing, because it could turn the opposite direction, and I'd be adding more staff to make sure we don't get a curve, if that makes sense. The other part that you talked about is, so in any community, we always try to reach what we call herd immunity. That means certain amount of people be infected, certain amount of people be immune, and until we get a vaccine, that's what the disease that keeps spreading because it has an available host. So you're hoping that it eventually bumps its head up against people that are immune and herd immunity, and then it stops spreading. And if that doesn't happen, the only other aspect you do is make sure you introduce a vaccine. And then you'll reach herd immunity in that place. When you don't do stay-at-home orders, you don't do any of the measures we have done, the disease will continue to spread. So.
Could I ask a question about the immunity issue? Do we really know whether once people have this thing, they're immune, or is there a mutation of the virus that that they didn't have that could turn around and reinfect them? What's the thinking about that? I know there's probably not a lot of research yet because it's still in its infancy, but.
Yeah, right now, the only research that I have seen thus far, and I've been paying a lot of attention to it, is that a person cannot be reinfected within 3 months. Now, that could very well change. But as of right now, that's the only data that I have available.
And there's no data to suggest that when the virus is apparently mutated in some situations, so, that you could get a different form of it? Is that correct or not?
I-
We don't know.
I haven't.
We just don't
I
know.
haven't seen that yet. Yeah.
We don't know. Okay.
Dr. Jett, a couple questions here. One, if Brookline were to adopt some sort of stay-home order, some more, again, these more aggressive measures, and only Brookline did it, in your estimation, would that still be effective? Or, I mean, obviously, I would imagine it'd be more effective if everyone else was doing the same thing, but would it still be effective if it was just us doing it?
No, it wouldn't be, because we are bordering Newton, Cambridge, Boston, and Brighton, some other communities. So I'd like a regional approach, because I think it's very effective that way. And I love it even better when it's a statewide approach, because it puts everybody on the same page, and we all work in the same direction to actually get to the peak and flatten the curve, whatever exists in there.
Okay, thank you. And then the other question was, there's been a lot of news locally and also nationally about who's been most impacted and by COVID, who's who's contracting this virus and who's dying from it. Do we have any sense of our own Brookline data? I know that I saw from statewide that 2/3 of the data did not have race attached to it, for instance. I don't know if we know anything about race, income, or if there are any particular hotspots in Brookline that we should be aware of and work to mitigate.
So you are correct. I did get a call from a reporter. So I ensured that we put in the data about race, and that's how we train for MAPE. I know there's been some discussion that everybody's not doing that across the state. What you have seen in the nation overall is that, and this goes with any disease, so COVID is no different. It mainly impacts the vulnerable parts of the population. So that'll be the elderly, it'll be usually the young, and in other cases, it'll be people with chronic diseases. Poverty, race, education is big correlated in terms of exacerbation of disease. So there are studies now showing, and for people that know about social determinants of health and health inequities, it always surfaces that the people that have the less income, less educated, more in poverty, have greater chronic diseases. So that number is higher now in African American communities for COVID. We at this point, I haven't seen that in the data, but one of the things I'm going to do is start to scrub the data. If I don't have the time, I'm going to hire epidemiologists to do a deeper dive. We just don't have enough cases to really take a deeper dive at it. But I'm sure there'll be some very telling data, something coming out of Boston. At least I would hope that.
Yeah, I'd appreciate you looking into that. And yeah, I understand the N is low right now for Brookline, which is a good thing. But to the extent that we can look at the data we do have and see if how it's tracking with some of what we're seeing nationally would be really helpful in the future.
Yeah, now what I have done, I have had the data that we do have plotted. So there is no one place that anybody is safe. We are surrounded. There is cases everywhere.
So geographically, you're seeing it all over Brookline. The cases where they're scattered throughout Brookline.
They scattered throughout Brookline, and I could send a map to you afterwards, so you would see. So I can't say like everybody's in Coos Corner, or everybody's in Washington Square, or everybody's on Chestnut Hill. They're everywhere. Yeah. The only difference,
as long as it's like a heat map that obviously doesn't have plot points on where people live, right? But some kind of heat map or something like that.
Yeah, it's just dots. So, it's just a lot of dots, a lot of red dots. Yeah.
Thank you.
Dr. Jett, can you just clarify the guidance around use of masks or face coverings? I see sort of 50% of people on either side of the equation here, but half the people I observe are wearing some sort of mask and half the people aren't. And that makes me wonder what sort of guidance you're recommending and how I should interpret the state and federal guidance on masks.
Well, so my guidance has always been everybody should wear a mask, regardless if you asymptomatic or symptomatic. And the reason that I've always said that, and I would always say that, is because it's sort of contradictory to tell people only wear a mask if you're sick. But on the other hand, if you're asymptomatic, you might be a carrier. So that's sort of contradictory evidence. So to be safe, everybody needs to wear a mask. And it doesn't make a difference if it's cloth, N95. You need something to protect your face and your eyes. That's why they come up with different materials or whatever. To me, it's always better to be safe than sorry and use precautionary principle on that fact.
But my understanding is those N95 masks really should be reserved for healthcare workers.
Correct.
If somebody's got a box in their basement, talk to Select Person Heller about donating it, or somebody else. Don't save it for yourself if you're asymptomatic and aren't providing patient care.
And
That's
a lot
correct.
of people have donated them, and we're very thankful, and we've transported them right to the hospital. So, so we know that they're going to be put to good use.
Dr. Jett, could you talk a little bit more about the value of cloth face coverings? How good do they keep the virus out of someone's nose or mouth if they're covering those areas of their face?
Well, I think, and there's levels of what type of material. So the N95 or the FFP3, probably the best mask you can get.
I'm asking about cloth coverings that we would make ourselves from bandanas, for example.
Yeah, now I don't know how effective that is. I would have to do some type of testing to see. But I think if you're talking about stuff that you're trying to prevent in droplet form, the ideal is to have something to cover your face and effectively move away or be 6 feet away from the person. I think sometimes people wear a mask and they feel a sense of safety or comfortability that they won't get the virus. The best method is to have something on your face and eyes and stay 6 feet or further away from the individual, especially if you know somebody's sick.
Any other questions?
So, has the task force talked about a stay-at-home order? And do we know if that's being discussed at the state level?
The
Maybe
task
Mr.
force, we have discussed it, but we have been thinking about waiting on the state and see what the state does.
Do we know what's happening at the state level about that?
No, I would defer to Mel to collect up for an update on that. I'm not on that.
I listen to the governor every day, like some of you do, and very carefully try to listen to his words and especially his responses to questions. I would say they're probably considering it, but I don't see any imminent change from the current practice.
So what would a stay-at-home order add to what we currently do here in Brookline? It would be an order, but how would we enforce it, and how does it differ from just our urging people to stay at home?
My guess is, hearing about it in other jurisdictions, other countries, that that you would have to actually have some. You have to register to go to a grocery store. You have to register to go to, and then you're probably given some document where you download and you have with you. So anytime a police officer would stop you, you'd have to show that document. Otherwise, you could not be out. That's what I understand is done in Italy and other places where they have a true stay-at-home order. But maybe I'm not knowing, exactly what the terminology is and what the state is considering.
Yeah, I could add what I've seen in other states that have done stay-at-home, since I still travel. One of the biggest aspects of it is a curfew. And so a curfew effectively moves people off the street. And, you could be stopped. Now, I haven't seen it enforced yet, but I have seen police do more surveillance. And so some places set a curfew of 10:30. Some places set a curfew of 12. I do know in France, the stay-at-home orders, you did have to have some type of documentation on you if you got stopped. And you had to explain why you were out. It had to be specified time period as well.
So with regards to a curfew, I guess I'm scratching my head. I understand that not a lot of activities take place after, let's say, 10:30 p.m. at night. Why target that period of time without addressing those who choose to go out during the day?
So I just brought up the fact of what other communities have done. I wasn't suggesting that. The streets are pretty empty at night in Brookline. But the mere stay at home, that's how other communities have implemented it. There was a curfew attached to it, at least, in the States. I wouldn't suggest that for Brookline because usually around 8 or 9 o'clock, the streets are pretty bare.
Yeah, it makes sense to me. And the virus is not nocturnal. The virus is around during the day. Just thinking a little bit more about this, I guess one question for Dr. Jett and one question for Mel would be around, actually starting with Mel maybe. Where are you represent us on the Metro Mayor's sort of council. This is, I was on one of those calls where it's, Somerville and Cambridge and Boston and some of the other communities in the area. Are they talking about more aggressive measures like this? Where are they at?
Well, the Metro Mayor's Group, kind of has expanded, and the calls you're hearing from now are including other parts of the state. So it's hard to really say exactly what entity that really is. There has been talk, in fact, I think you all saw a letter that some of the mayors sent, but that was a subset of just a group of regional cities who have mayors, executives that I believe encouraged the governor to take more aggressive action, including a stay-at-home order. I can't remember the exact verbiage of that. But that was more of an ad hoc measure. We were offered to participate in that, but by the time it came to my attention, there was no board meeting scheduled, and I had a 6 p.m. deadline. And as you know, I did want to know a little bit about how you felt about it, and it was pretty clear to me that the actual language, it was hard for everybody to get on board with all of it, and so I couldn't sign it. That's sort of one of the impediments of being a town on this Metro Mayor's Task Force. I think Arlington and us we often say the same thing. We really can't take a position without getting guidance from our executive board or elected board, whereas mayors, of course, don't have to do that.
Well, I guess, are they also thinking about, assuming the governor doesn't respond, and he's showed no indication that he's at this point anyway, that he's interested in a stay-home order for the state? Has there been any discussion of a regional approach, like the communities coming together and doing this on their own without the governor taking action?
There has been some discussion, but I don't believe that everybody feels it will be practical for the same reason that what Dr. Jett said. It's just, first of all, what region is it? It's going to be hard to get every city and town in the Metro Mayor's Group to do that even. And so I don't think it sounds too practical that would happen. So I think the advocacy of the governor is the angle that's being promoted at this time.
But it can't be the case that for us to maybe increase our efforts or increase our encouragement of people to stay at home, harsher enforcement of the mitigation requirements for grocery stores and others. I mean, that even though we're doing it alone, I mean, it can't be useless. I mean, it must help some.
Well, we're not doing that alone. We have. I think most communities are doing the same thing with the grocery stores, and then the governor just submitted an order that limits the occupancy of the grocery stores. But I agree. We can be more aggressive, and I think we probably are in some areas. I think we're doing a great job with the food service, and we should keep it up.
I do think we can do more in terms of, and that's one of my next phases is we're not doing enough, I feel, in terms of educating the community. So I want to push more for health educators to be out. So it might be me working with students, because I got a couple of students from Harvard, but I want to do more education and promotion activities. And one aspect, I'm kind of liberal putting people on the street to do education. But on the other aspect, we need to do more in terms of video, billboards, or look for some other mechanism that other communities normally would use in terms of educating people and changing behavior. Because right now we're talking about healthy behavior.
What about the
And-
super boards?
But we need to use the super boards, any mechanism that we have. We need to constantly begin to use that in order to educate people and try to move them in a direction we want to. I'm afraid that, we do a good job in reaching town meeting members or 2,000 people. I think we're not reaching the other 58,000 people.
One thing that I would, let me ask you if you think that this is a good idea, and that is sound trucks up and down Harvard and Beacon Street and other areas. People ignore the super boards if they even look at them, but a sound truck, which is an old 1960s technique, may be something that should be considered. Just
I agree. It may be an effective way of suggesting to people that if they're out just for a stroll, it'd be better to, walk around the living room and jump up and down with jumping jacks than to be outside, at risk, putting
or at least
themselves at
not
risk.
clumped together. I mean, that's the main problem that I see, particularly young people sort of walking in packs, 4 or 5 people, and
But it's not because they don't have room on the sidewalk. It's because they want to walk together.
Yeah, they want to hang out with their friends. I can understand that.
Right.
I'll just say 2 things about using anything with sound. One, we get a lot of complaints about noise on various projects that go on in town. People work very odd hours sometimes, especially essential workers. And no time of the day is good for a loudspeaker. I agree at its effectiveness, but it's something to keep in mind. The other thing that I'll point out is there is a risk of abuse. I know that a few communities have gotten themselves into trouble with using a particular siren sound that's associated with a Netflix show called The Purge. So,
hopefully we're smarter than that.
You're only as strong as an employee that gets to push the button.
Well, I assume that Dr. Jett would control that button.
I would.
But no, that's a legitimate concern, Heather. I think that going up and down Harvard and Beacon, and with the sound truck that's not screechingly loud, but loud enough that people on the sidewalks can hear or gets their attention, is something that could be effective with that sort of group of people who are are typically the ones who are clustering in groups and sort of hanging out with their friends.
They did it in New York. I did see the police on the loudspeaker, actually telling people to keep 6 feet, 6 foot distance, etc.
I'd hope we don't use the police to do that, but I mean, I don't know. That's just my view.
They did it among making their rounds, so I don't think they were making any extra rounds. I think they just reinforced the message as they were driving by.
Right.
But of course, you got to remember it was New York and the situation that they were dealing with it.
Yeah.
Dr. Jett, how do you feel about compliance right now? We get like mixed messages. We get some folks sending us photos of deserted Brookline streets, and other folks telling us there's, I don't know, like it's like Mardi Gras out there. What is your sense of compliance in Brookline in terms of people, for the most part, staying home?
I think after 5 o'clock, people are probably abiding by it. But between the hours of 10 and 5, they are not, especially in some of our hot spots that I consider the high traffic, the high commercial area. It seems to be in those areas people do the most exercise, grocery shopping, walking, talking and laughing in groups, or waiting in line. And I actually take the time to drive in these areas every day. And, I see a repeat. I think the social distancing, one of the things that I will emphasize because I'm doing personal inspections in the grocery stores, I will talk to the managers and constantly refresh them the memory on proper social distancing of employees, because I see people doing it, but sometimes I see the staff not doing it. And then just reiterate too, to ensure that staff are not coming to work sick, because I have noticed that in a couple of instances as well. As I'm still seeing a few grocery stores coming back with positive tests. So that lets me know that we might be getting the message out to them in terms of wearing a mask, but still some of the behaviors that I've seen employees do, to me, it's not acceptable. And I've received emails about it, and I'm sure everybody has as well.
I have to say, I was on an essential walk today, and walked by the Trader Joe's, and there were lines in the front and the back. They were well spaced. Everyone looked very sad, but people were complying with what's being asked of them while waiting in line there. It seemed anyway. So that at least, I hadn't been inside. I haven't been in a grocery store in a little while, but that at least seemed like some good news when I walked by there.
Yeah.
I was in Trader Joe's yesterday, and they were notifying everyone that was in line that would be the last day that they could enter without a mask. They've done a very good job of educating their customers as to social distancing best practices.
That's great to hear, because they weren't doing a very good job a week or so ago. I was in Whole Foods, and they had a very, very good system of keeping the line outside separated. There weren't a lot of people, frankly. And inside, they had people going around making sure that people kept a distance. Now, some of their employees were not wearing masks, which is, of course, that Whole Foods is in Boston, so can't send Dr. Jett out to get one out. But
I don't think they would like that.
But maybe we should. Actually, I'll send an email to whoever and just make a note of that, or indicate that they should fix that piece. But otherwise, it was. I mean, they're taking this very seriously, and I think the food order that you issued was very, very helpful in that regard, and of course, the governor's order on that too.
Thank you. I owe that to the staff and helping me get it together in the rush. But I think we need to go one step further, and I did suggest to Pat that we need to do it for all essential business that's still open, not just places where people grab their food at. So I'm actually going to move in a direction to extend it.
What other businesses would they be besides pharmacies and restaurants?
There would be pharmacies, hardware stores.
And if folks have questions about, those essential businesses have questions about what they should be doing, how should they reach out to you and your colleagues in the health department for feedback? What's the most effective way for back and forth?
617-730-2300. We've received in the last week about 50 to 60 calls just on the food advisory. So the amount of calls have picked up tremendously. And of course, we're doing spot checks to all of the venues. I personally went to every large grocery store to talk to the manager. But staff is doing spot checks in every other place.
So I just want to get clarification on something we talked about earlier in this call. You made mention of the fact that there was going to be possibly testing a week from tomorrow, sometime late next week. Who is that testing for? Is that for town town employees? Is it for members of the public?
It's for members of the public, it's for residents only, and they must be symptomatic. And it'll be physician one is the group that'll be doing it. We're trying to secure locations. Chief Sullivan was working with them. I think they're having a site testing location now at Chestnut Hill. They're doing something this Friday or Saturday. So we're going to try to duplicate that site for next Saturday so that we don't have to recreate the wheel.
So the same rules that are in place now around needing a physician to refer you and it not being sort of a lineup and it's the first 300 people that are there that get tested. It's just an additional location to expand capacity, not to change the rules for who gets tested or how testing takes place. Is that accurate?
And could that apply to our employees also? I mean, may not be residents, but can they get that test there? Can they get the test as well?
Well, I think they're restricting this too because they're doing one in every community. I think this is going to be for Brookline residents.
Mm-hmm.
We have other ways to get our employees tested. There are, I noticed that there's a major center in Foxborough that is restricted for first responders. So I don't think we had that much impediment to getting our employees tested if there's a impact on our capacity to provide services.
Do we know the number of employees who have been affected?
Yes, the ones that have reported to me thus far, there has been 8 thus far, approximately 8. So 5 from the fire department, 1 DPW.
I won't mention the other one because it's a small department.
Yeah, it might be more. Yeah, I won't mention the other one. A few more surrounding DPW. And possibly a few in the library. So yeah, I'd say approximately 8 to 10. I don't want to single out because we probably would make it very obvious.
Right.
So our numbers are very low. But one of the things, once I saw, and I made a suggestion, once I saw us have a few cases, I thought it'd be good for the town to go virtual and just reduce the foot traffic in all buildings of essential services. And I think that's one way we can find out who is truly essential, has to be at the office versus who doesn't.
Just on the topic of testing, I'll close by saying I think I'm happy to hear that our staff, our town employees have access to testing. The other thing that's been troubling to me in what I've read in the paper and heard in the news is the pace at which we get results. And as we're thinking about employees who in the DPW, for example, or in the fire department are working in close quarters, the faster we know somebody's status and can isolate them, the more effective we are at limiting the contagion and spread. But that's something else that's on my mind.
I also, since this meeting may be coming to a close, but I want to bring up the issue of the memo from the Advisory Council on Public Health about social distancing in the streets. And that memo apparently came in on Tuesday night, but we did not see it until, I believe, yesterday. It was not forwarded to us. And I do not believe, although it did go to the Transportation Board members, I believe, they did not discuss it in their deliberations. So we didn't discuss it and they didn't discuss it. So that kind of bothers me. I think that we need to have a better process around this stuff. We need to have all the information. In this kind of crisis, the people we should be listening to are the healthcare sector, and in my view. I also, so I'm hoping we will discuss that next at our next regularly scheduled meeting. And I'm hoping that the Transportation Board will also discuss it. I think that we owe it to the public to let the public know what that memo said and why. And I think Dr. Jett has indicated today a lot of those reasons for that memo and for the thinking behind it, which is really important.
Yeah.
I'm happy that we're not at high numbers, and I don't want us to be, and I don't think any of us want us to be. So we have to think about the best way to keep this thing under control, at least in Brookline. That's all we can do. I mean, we don't have a choice. We don't have an opportunity to keep it low in the state as a whole or in any other state, but we can do that in Brookline.
And can I just add, Mel, could we make sure that the packet that the board receives and that's posted includes that memo as well as Todd Corain's memo that we received like a couple hours before our board meeting? So that we at least have that information for our discussion.
Yes, I will. If it doesn't make it in the first round, it'll be to you over the weekend.
Right.
And we'll make sure it's posted. Those two documents are posted publicly as part of the part of your agenda materials.
Can I add that the Mass Municipal Association has a weekly briefing and had a lot of information regarding legislation that has been enacted over the last few days. Mel, do you know if that's going to be available as a PDF document? I know that they're going to post the actual meeting video or video online, but you know if the written materials will be available?
I don't, but I believe they're keeping sort of this Google Drive on all the materials that are being submitted. So I'm pretty sure they have that repository, but I'll double check.
Okay.
If you're referring to the noon update that was held today, they asked for people to send their email addresses, and they were going to send the PowerPoint presentation. So once I get that, I can send that to both UML.
Okay, I should be on that list too. Okay. But I guess I missed that. I thought they were just posting the video. But
I was on the call also, and they cited. You can go to I think MMA.org and get the materials. They cited a lot of different regulations. Apparently, the governor has issued something like 49 executive orders on this thing.
Yeah.
And they're all listed on that site. So.
Not easily found, though. At least I couldn't find it. I don't know. Anyway, okay, thanks. Anything else?
Yeah, I'd like to do a direct ask if around going back to the data. I think if we could, and I know it might take a few days to get this together, but I think it'd be important to, at this point, publish the data that we have beyond the raw numbers. If we could do publish the data at least by race, maybe age ranges, X number of years to this number of years. This is on the positive cases, and maybe gender and any other demographic but not identifiable information that we might have. I don't know if there's anything beyond those three. And then I think also maybe it might be helpful to understand, what extent living or not living in a dense environment, dense area of town might be impacting things. Maybe if there was a way to do the cases by precinct. I was trying to think of like how to break it down so it's not identifiable, but maybe we do have these 16 precincts in Brookline. Maybe that's a halfway decent way to do it. There might be a better way. But if we can look at geographically also like plotting that information without making it identifiable, I think that could maybe be helpful. I'm not quite sure. It might just be interesting. But I think it's probably time to start publishing some of the data that we have so that the public can see it.
So what I can promise you I can do, because, all of our people doing contact tracing, I'm the only person that run your numbers. So I would have to either hire somebody to do it, or I would need more time to pull it from Maven and to do it. So my intent was to look from the beginning when we first had a case, to put in charts the trend I'm going to use SPSS, which is usually a software package I use. And right now we have a free trial until July. So that's one of my attempts, and I can chart everything. It'll be easy for me to identify by race. I can go in Maven and start pulling that, and I have that data. It might take me a little more time to try to do it by precinct. So I would ask her staff to assist with that because they help with the plotting of GIS, ArcGIS, to do that for me. So, but, probably I would say, give me at least till Friday. I probably have a better idea. I want it to look nice and presentable when we start to post it.
Absolutely, that's important and of course accurate. Mel, is that an okay use of resources considering everything?
Yes. I was just going to say, Swanee, that we have a particular gentleman in the GIS. I don't know if you've worked with him before, but he's done a lot of work with other groups in trying to use the GIS system to help with some of that data. So I'll catch up with you later.
Jed has already plotted for me, so I've been having him to do it, and I just didn't share it today because I didn't want to pull it up. So he did do a plot for me of just the cases, but I have asked him to do an overlay of education, poverty, so those things. So I have to provide that data for him to do it. He originally did the original analysis for me 2 years ago, so now I'm asking him to add layers to it.
Appreciate that, guys. Thank you.
No problem.
Actually, I just let you know that he is on the census committee, but it's been very hard for him to attend because he's so busy doing this kind of stuff for the town, which is appropriate and good. But that brings me to remind everyone, fill out your census, go online, takes 10 minutes, et cetera, et cetera.
Great. Anything else?
One more quick question. This was related to Ben's question about testing. I know, Swanee, you got kicked off at that point, but we're talking about the turnaround time. Do you know what the turnaround time on testing is now? Like someone gets tested to when they're able to be notified whether or not they're positive?
So it depends on who does the testing. So I don't have all the data in front of me. Some of the tests usually is a day, but I heard there's a rapid test in 15 minutes. But I guess it depends on who's doing it.
Do we know what the physician one group will be using?
I don't know at this time. I'm still getting all the logistics in. They email me. I see the emails coming in while I'm on the phone. But they're going to get that to me, so I will have a better idea.
Appreciate it. Thank you.
Could I raise one more issue? I know earlier, I think it was Raul who pointed out that at the state level, there are seem like different messages coming out. And I think it's important for Brookline to have a central messenger so that we speak with a voice. And I think that we've had a little bit, we've diverted from that somewhat. And I think we should make sure we go back to it. And I would hope that Mel and Swanee and the task force could talk about how that's going to work and the specific methods for it to work. But I think that's really important. If we're doing anything related to COVID, it should be a message with the same elements, and it should be we should be speaking with one voice.
Well, I agree generally with that. Although the town and our structure of government does not speak with one voice, and so it's hard sometimes to do that because what one person thinks is the right message, other people don't. So I think we're facing a little bit of that in the last week or so. So
yes, but the town, you're the chief executive. That
I am not the chief executive.
It's the chief administrator, the chief of staff. And the board is and all of the departments report they essentially report to you and then through you to the board. So I think we do need, it's really important in this time of crisis to have a voice that, is consistent. And I know that's more burdensome, but
it's not so much the burden. It's just making sure that I represent the select board, who is the chief executive body of the town. And I think it's obvious that we have differences of opinion, the board has, and so that puts a very difficult burden on the town, on the town administrator or the task force to serve in that role. I was criticized a lot in the first few days when we were making decisions that, weren't vetted through the regular governance process of this town. So, I agree with the concept. It's easier said than done, I think.
Okay, anything else? I guess we can adjourn the meeting. Unless
Happy
anyone
holiday, everybody.
has anything else.
Thank
Yes,
you.
have a safe holiday.
Yeah.
All right. Have a good holiday.
I hope your Easter eggs are already in your refrigerator. So you don't have to come out and get them.
Good weekend.